After our recent video breaking down how a drug is used to offer relief for individuals suffering from lupus, we received many comments for us to break down the drug known as Saphnelo. So let's talk about that one today. This is a monoclonal antibody with the name of Anifrolumab, and it's used for SLE, or systemic lupus erythematosus. And previously we talked about Benlysta, which goes in and targets BLYS, that protein. However, Saphnelo targets an upstream protein called INF receptor, and this is given as just an IV administration currently. Now, this is due to the fact that patients with SLE are seen to have increased levels of a protein called INF alpha, which goes in and attaches to this receptor that we're going to talk about in just a minute. So if we look at how lupus actually causes inflammation in the body, this is due to autoreactive or defective B cells that should have been cleared from our immune system, but they go on and they mature and overproduce autoantibodies, or antibodies that are able to attack our own proteins, leading to that severe inflammation. And one way that those autoreactive B cells are able to mature is when a protein called INF alpha is able to come in and bind to the INF receptor. This helps to activate that B cell and decrease the threshold needed for activation. So let's say that that activation was at a 10, now that activation lowers to, say, a 3, making it much more easy for those B cells to overproduce autoantibodies. However, when Saphnelo is added, this monoclonal antibody is able to block that INF receptor, preventing INF alpha from coming in and attaching to it, therefore not allowing that decrease in threshold for the maturation of those autoreactive B cells. This therefore decreases the amount of autoantibodies that are being produced and overall decreases inflammation for those patients. So if you have another drug that you want to learn more about, make sure to drop a comment on this video and stay connected to my channel and with Dane Garvin. Thank you all so much for watching, and if you're not already, make sure you're subscribed to the channel by clicking over here, and you may also enjoy this related video that I have over here. I'll see you on the next one.